Have you ever woken up in the middle of the night because of a sharp pain in your big toe? It feels like a needle stabbing, burning, and swelling so much you can't even bear the touch of a blanket. Have you, or a loved one, ever been diagnosed with mild gout and thought, it's just a fleeting pain, it'll pass? If you're thinking that way, be careful. Because what you're brushing off could be silently eroding your joints, damaging your kidneys, and tanking your quality of life. Hello, welcome to JointWise Health, where we health and nutrition experts join middle-aged and older adults on a journey to smarter, compassionate healthcare. If you find this video helpful, please hit like and subscribe. It's a small action that helps us keep sharing valuable knowledge with the community. Today, I want to share something critical, perhaps the most important thing if you're living with gout or caring for someone who is. Gout isn't just occasional pain. It progresses. And if you don't understand its stages, you might miss the best chance to control it, prevent complications, and live healthier for longer. Picture gout as a slope. At the top, you're healthy, pain-free. But if you're not careful, you'll slide down without brakes until gout becomes chronic, disabling, or even causes kidney failure. So, how does gout start? And why do so many people ignore the early signs? Let's start with the first stage, where most of us don't even realize the disease is knocking. I remember a patient, Walter, a 62-year-old former barbecue restaurant chef from Texas. He came to me, embarrassed. I thought it was just pain from standing too long, doc. Figured some ice would fix it. It didn't. Here's the first thing to note: stage 1, high uric acid levels, but no symptoms, The scary part? You feel nothing. No pain, no swelling, no redness. But inside, uric acid is quietly building up in your blood, ready to form urate crystals in your joints. High uric acid, called hyperuricemia, doesn't always lead to gout right away. But it's the foundation for it. In middle-aged and older adults, the kidney's ability to clear uric acid weakens, especially if you have high blood pressure, diabetes, or take diuretics. Remember, you don't need to feel pain to have a problem. So, who's at risk for high uric acid? Let's look at some factors. Age 50 or older, especially men. Regular consumption of red meat, seafood, or alcohol, particularly beer. Being overweight, obese, or having metabolic syndrome. Taking blood pressure medications like diuretics, thiazides, furosemide. A family history of gout. If you or a loved one fit these groups, checking uric acid levels yearly is non-negotiable. At JointWise Health, we emphasize preventing it while it's still silent is the smartest way to stay ahead. If left unchecked, you enter stage 2, the first acute gout attack. Walter, the chef, experienced this painfully. I've never felt pain like that, doc. My whole foot was burning, even a sheet touching it hurt. That's a classic description. Acute gout attacks often strike at night, usually in the big toe, but also in ankles, knees, or hands. It hits suddenly, intense pain, redness, and swelling like a small balloon. Many mistake it for an injury or another type of arthritis. Here's the tricky and dangerous part: the pain subsides in a few days to a week, even without treatment. That's why so many brush it off. They think, must have been that party last night, and return to old habits. But here's the truth: that attack is a serious warning. Your body's saying, I can't handle this uric acid anymore. Each time you ignore it, urate crystals keep building, silently damaging joints and setting the stage for chronic inflammation later. The good news? If you catch gout in stage 1 or 2, you can still control and prevent its progression effectively. Proper nutrition, staying hydrated, losing weight if needed, and medication when necessary can reverse the buildup of urate. Wondering about the right diet for gout? Don't worry, we'll cover that in a dedicated video in our upcoming Nutrition and Gout series on JointWise Health. Be sure to subscribe so you don't miss it. So, we've seen the first two stages, from silent uric acid buildup to the first painful wake-up call at night. I hope, if you're in one of these stages, you see the value of acting today. In the next part, we'll explore what happens if you don't intervene early when gout becomes a frequent visitor, causing repeated inflammation and joint destruction. Stay with me for the next part, where we'll discuss chronic progression and the consequences of not acting in time. If you found this helpful, leave a comment, ask a question, or share your story to help build a healthier, proactive community together. There's something I always tell my patients. Gout isn't just a one-night disease. It's a journey. And if you don't take the wheel, that journey can veer far off course. Imagine you've gotten through your first gout attack, or maybe your second or third. But instead of learning to manage it, you think, it's just occasional pain, not a big deal. Walter, the 62-year-old chef I mentioned earlier, is a perfect example. After his first gout attack, he took a few days off, cut back on beer, and went right back to his old ways. 6 months later, he came to me limping, with a swollen knee and fingers that couldn't bend properly anymore. That's when you enter stage 3, recurrent gout, also called intermittent gout. This stage can last years, and the danger is, the attacks don't just happen once or twice a year anymore. They come more often every few months, then every few weeks, even weekly. The pain isn't limited to your big toe anymore, it spreads to ankles, knees, wrists, elbows. And each gout flare leaves scars in your joints as urate crystals build up. You might start noticing changes like pain lasting longer, from 7 to 10 days, even up to 2 weeks. Needing stronger painkillers. Joints feeling stubborn, harder to move after each flare. Loss of flexibility, with joints easily spraining. The same joint getting hit repeatedly. This doesn't just limit your movement, it affects your mental health and quality of life. A middle-aged man who's working fine one day might be stuck at home for a week, unable to walk. A grandma who loves caring for her grandkids might need her daughter-in-law's help just to take a step because her knee keeps stabbing with pain. Here's a tough truth for this stage. Every gout flare is a battle your body is losing against uric acid. Why does this happen more in middle-aged and older adults? Simple, as we age, our liver, kidneys, and metabolism slow down. Our bodies don't clear uric acid as well as they did when we were young. Plus, many older adults are managing high blood pressure, chronic kidney disease, or diabetes, conditions that naturally increase urate buildup. And when these flares become your new normal, chronic joint inflammation creeps in. Stage 4, chronic gouty arthritis, deformity, constant pain, lifelong impact. If earlier stages brought pain that came and went, in this stage, the pain rarely fully goes away. Patients often describe it as aching all day, can't sleep at night. Joints are stiff in the morning, I need to massage them for 15 minutes just to move. Sitting for a bit means I need to grab a chair to stand up. This is when urate crystals have settled in your joints, long-term eroding cartilage, damaging joints, and even forming tophi, swollen lumps under the skin on hands, feet, ears, or knees. You may have seen them, white, soft lumps on finger joints, looking like pimples or small cysts, but they're actually uric acid crystals. Tophi don't just cause pain and discomfort, if untreated, they can ulcerate or get infected. In severe cases, large tophi can limit movement or permanently deform joints. So, the question is, can you reverse this or at least stop it from getting worse? The answer is yes, but not by just popping painkillers during flares. You need a comprehensive plan, including regular uric acid monitoring and medications like allopurinol or febuxostat, as prescribed by your doctor. Managing underlying conditions like high blood pressure, diabetes, or kidney disease. Lifestyle changes, especially a gout-friendly diet, avoiding high-purine foods, drinking plenty of water, and controlling weight. Most importantly, never ignore any joint pain, even if it's just one flare. I always tell my patients, you can live with gout without suffering from it if you take charge. If you're caring for an older adult with gout, don't wait for them to complain. Watch for signs. Are they walking slower? Struggling to sit or stand? Moving their hands or feet less? Avoiding activities they used to enjoy? These could be early signs of chronic gout, where pain isn't always intense but grinds away slowly. Now that you see how gout progresses from flash pains to chronic, life-altering damage, I hope you grasp how serious it can be if not managed well. In the next part, we'll cover the most dangerous stage, when gout isn't just about joints but impacts your kidneys, heart, and even your life. Get ready, because this is where gout reveals itself as a full-body disease you can't ignore. There's a truth many gout patients, especially middle-aged and older adults, rarely hear. Gout doesn't just cause joint pain. It can damage your kidneys, harm your heart, and even shorten your life. It sounds extreme, but let me share a real case. Evelyn, a 74-year-old kind-hearted woman from Arizona, a former nurse, came in with swollen legs, reduced urination, and shortness of breath when lying down. At first, everyone thought it was just old age or mild heart failure. But tests revealed severe kidney damage, high creatinine and urate crystals in her urine. The heartbreaking part? Evelyn had a history of gout for years, with tophi on her fingers, but she thought, it's just a joint issue, no big deal. This is stage 5, gout with systemic complications, especially kidney damage****. 1. Gout and kidney failure, the dangerous link. Did you know uric acid is cleared by your kidneys? Every day, your kidneys filter liters of blood to remove waste, including uric acid. But when uric acid levels are too high for too long, it doesn't just settle in joints, it builds up in kidney tubules and tissue. The result? Interstitial kidney inflammation from urate crystals. Reduced glomerular filtration function. Secondary high blood pressure from kidney damage. Eventually, irreversible chronic kidney failure. Worse, kidney damage makes uric acid build up even more, as the kidneys can't clear it effectively. This creates a deadly vicious cycle. In older adults, kidney function naturally declines with age. Add uncontrolled gout, and the risk of chronic kidney failure skyrockets. 2. Gout and cardiovascular complications. Many are shocked to learn. Gout increases the risk of heart attack and stroke. A major U.S. study, JAMA Cardiology, found that gout patients have a higher risk of dying from cardiovascular disease than those without gout, even when other risk factors are treated. Why? First, high uric acid triggers widespread inflammation, not just in joints but in blood vessel walls. Second, gout patients often have coexisting conditions like high blood pressure, obesity, or high cholesterol, which fuel atherosclerosis. Third, long-term use of some painkillers for gout, like NSAIDs, can raise blood pressure and harm the heart if overused. So, if you have gout and high blood pressure, don't treat them as separate issues. They're closely linked, and treating them independently misses the chance to protect your heart. 3. Gout and mental/emotional impact. Something rarely discussed, but I see it often in older gout patients. They start feeling helpless about their bodies. Unable to walk as far as before. No longer able to play golf, garden, or hold grandkids due to joint pain. Fearful of eating, unsure what might trigger a flare. Constant anxiety about when the next attack will hit. These erode mental and emotional well-being, leading to mild depression, isolation, or loss of confidence in social settings. For those living alone or elderly patients without regular caregivers, gout becomes a significant emotional burden. For severe joint complications, muscle wasting and deformity. A joint attack by gout for years doesn't just swell and hurt, it starts to lose cartilage, narrow joint spaces, form bone spurs and severe osteoarthritis. Become stiff or permanently deformed. Have you seen hands or feet twisted from swollen, misaligned joints? That's the result of uncontrolled gout. When joints stop working, surrounding muscles waste away, making gripping or walking extremely difficult. Patients may need crutches, walkers, or wheelchairs, losing all independence in daily life. No one wants to spend their later years like that because of a simple disease like gout left untreated. 5. Gout and risk of infection, ulcers, and amputation. This happens when tophi burst, often on hands, feet, ankles, or elbows. The tophi leak a chalky white substance, which can lead to skin infections. If not properly treated or if the patient has diabetes, the infection can spread, potentially causing tissue necrosis or even amputation. This isn't scare tactics, it's a clinical reality I and my colleagues in geriatric clinics have witnessed. So, you might be wondering, if I, or a loved one, am already in the complication stage, is there any hope? I'll say it clearly, there is always hope. But you need a comprehensive recovery plan. What you can do today. See a rheumatologist or nephrologist regularly to assess kidney function, uric acid levels, and joint health. Avoid long-term use of painkillers without a doctor's guidance. Combine anti-inflammatory drugs, uric acid-lowering medications, and kidney/heart support as prescribed. Try gentle physical therapy like swimming, yoga, or short walks to protect joints without overloading them. Stay positive, join a gout support group or share with loved ones. Gout isn't your fault. It's a metabolic disease you can manage with the right approach. Adopt a gout-friendly diet, low in purines, low in sugar, high in greens, and plenty of water. Stay tuned for our detailed nutrition and gout videos on JointWise Health. Gout is a chronic disease, but it doesn't have the right to steal your dignity, joy, or lifespan unless you let it. If you're in the complication stage or caring for someone with severe gout, know this, you're not alone. At JointWise Health, we're here with knowledge, support, and practical solutions to help you reclaim control over your health. In the next part, we'll review the entire progression of gout and share actionable steps you can take today to transform your life, no matter what stage you're in. As we wrap up today's conversation, whether living with gout or caring for someone who might be feeling something, worry, regret, or maybe even hope. I want you to know this. It's never too late to change course. Even if you missed early signs, neglected treatment, or let gout progress further than you'd like, right now, you still hold the wheel. Let's revisit the key lessons from this journey, not as a checklist, but through a real story I've seen time and again in my clinic. I remember Ronald, a 67-year-old long-haul truck driver. He told me his first big toe pain hit at 59. I thought I sprained it from slamming the brakes too hard, he said with a sad smile. But the pain returned. First a few times a year. Then monthly. Then weekly. He started dreading work, even sleep, fearing the pain would strike at night. By 65, he could barely drive long routes, not because of bad eyes, but because his foot joints lost flexibility. When diagnosed with stage 3 kidney damage linked to gout, he said something I'll never forget. "If only I'd known gout wasn't just a joint problem sooner." That's why I want to close this video not with talk of disease, but with a message of taking charge. You might be in the silent stage, just learning your uric acid is high, thinking there's no need to act yet. You might have had 1 or 2 acute gout attacks, wondering how many more are coming. Or you might have lived with years of recurring flares, pain, and tophi, fearing what lies ahead. Wherever you are in this journey, remember, every step you take today, no matter how small, can shape the road ahead. What can you do right now? 1. Act early, before it's too late. If you've just learned your uric acid is high, don't brush it off. Get regular checkups, tweak your diet, drink more water, and lose weight if needed. You don't have to wait for pain to start making changes. 2. Don't suffer alone. If you're facing frequent flares, see a specialist. Proper uric acid lowering and anti-inflammatory treatment can help you regain control, not just mask the pain. If you're a caregiver, don't just listen to complaints, help your loved ones see an expert. 3. Don't let complications speak for your health. If you have signs of kidney issues, high blood pressure, protein in urine, or chest pain alongside gout, they're more connected than you think. A comprehensive care plan, combining your doctor, a nutritionist, and your efforts, can manage gout and protect your heart and kidneys. Most importantly, change doesn't need to be drastic. Start with simple steps. Drink enough water daily, 8 to 10 glasses of plain water, no caffeine. Swap red meat for white fish a few times a week. Take a gentle 15-minute walk each morning, no need for intense exercise. Make time to relax and reduce stress. Stress can trigger gout flares. Talk to your doctor about gout, sooner is better. You don't need to overhaul your life overnight. Just don't ignore the signs. Don't accept pain as a fact of life. I believe you can and deserve to live a healthy life, free from disease controlling you. You've navigated many stages of life, overcome countless challenges. Don't let gout stop you from enjoying your golden years with dignity and comfort. If you're looking for diet solutions, stay tuned for our in-depth nutrition and gout video series at JointWise Health, with detailed guidance on what to eat, what to avoid, and how to turn daily meals into a tool for healing. Please hit subscribe to catch every video. Give us a like if today's insights were helpful, and leave a comment to share your experience. Your story might help someone standing where you once were. Want us to cover a specific gout topic, like its impact on women, new treatments, or caring for long-damaged joints? Drop your request. This channel is for you. I'm Dr. James from JointWise Health. Wishing you a life of joy, health, and control over your body at any age. See you in the next video. Good health is a choice, and you just made yours today. Wishing you a peaceful day.